enter the room.
Hello, one of the doctors in the GP's emergency department. Can I know whom I'm speaking to? Hello?
Dr. Mishi?
Hello, I'm Sarah Osborne.
Okay. Hello, Sarah. So I understand you are here with Chloe. Can you please confirm her name and age, please?
Yes, her name is Chloe Davis, and she's 3 years old.
Okay. And can I also confirm your relationship with the child?
I'm her nanny doctor.
Okay. Thank you. I can't remember your name. Sorry. What was your name? I'm so sorry.
Sarah.
Sarah. Okay.
Doctor, my name is Sarah.
Sarah. Okay. Sarah, could you tell me what happened?
So, doctor, just 3 hours ago, Chloe pricked herself while she was playing in the park.
Oh, okay. Can you tell me a little bit more about it?
So, she was just playing on a slide in the park, and suddenly she landed on her hand, and she pricked her hand by a needle that had a syringe attached to it. The needle kind of, so me and all the nannies, we all witnessed this happen while she got injured. We all witnessed it.
Okay.
And yeah, so I'm really worried for her, doctor.
No.
Okay.
Counseling.
Hello? Yeah. So, Sarah, can you tell me when this happened, what happened? Like, was there any bleeding? Did you check the hand of the child?
Yes, I did. So there was very minimal bleeding. The needle looked quite clean, but she had some bleeding. So I squeezed her hand and I washed it under the running water. And I
Okay.
also threw the needle in the bin so that, no one else gets
Oh.
injured.
Well,
Get
you have
hit
done,
by it.
yeah. Well, that's really good, Sarah. So did you wash your hand with soap and water?
Yes, I did that, doctor.
Right. And the needle you said it look normal. Did it have any in the syringe? Did you notice anything, or what kind of, was it like a clean one, or was it covered in mud or anything?
It was quite clean, doctor. There were no any stains, no any blood seen on it.
Right. Okay. So after the incident, how was Chloe doing?
Oh, she was crying, doctor, and I got so worried. I immediately called her parents, and then they
Okay.
asked me that I should bring her here to the hospital.
Okay, that's really good, Sarah. So just to know a little bit about her health, do you have any idea about her general health, if whether she's having any medical problems?
No, doctor, none.
Okay. Does she have any allergies to any medications?
Nothing so far.
Okay. Is she on any medications?
No, doctor.
Okay. So how has she been generally? Has she been fit and healthy?
Yes, doctor. She's
Okay.
a very active child.
All right. And do you know whether she about her vaccination status? Like, has she had all her shots?
Yes, doctor.
Okay. Right. Anything regarding her health? Anything that I should be aware of?
No, doctor. She's completely fine.
Okay. Right. Thank you, Sarah. So, what do you think? Like, do you have any thoughts or ideas that you would like to share with me about this whole incident?
Yes, doctor. So I'm really worried if she has any risk of developing any infections because of the needle.
Right. Okay. And any other concerns?
Just worried about, losing my
Oh,
jobs. And I don't know, I know that I've read that, when someone gets any injury from a needle, they might have a risk of getting an HIV infection. So I'm worried and I want to know if she needs any sort of HIV prophylaxis. Will she be
okay.
given any antibiotics, something so that, she does
Right.
not get infected?
Okay. Thank you, Sarah. So it's really valid that you have all these concerns. I will like, address them all in a little bit. Anything else that you're expecting from this visit?
Yes, doctor. I just want to know if
Uh-huh.
she has any risk of developing any infection or
Right.
if she need any treatment.
Okay, thank you, Sarah. And I understand that you have talked with the parents. Do they have anything else that I should know? Any concerns from the parents?
No, doctor.
Okay, thank you, Sarah. So I would like to have a look at the child. Um, so it looks like that she's fine and she's playing with the nurse. So it's really good that she's doing well. So Sarah, to address all your concerns, I think she's 3 years and she has had all her jabs so far, and it includes the tetanus vaccine, but she has not completed the full course. So she might benefit from one booster dose of the tetanus vaccine. And also, you have done the correct first aid, like washing with soap and water. Um, we will have a look at the injury looks fine, but because you found it in the playground and we are not sure what it is actually.
2 minutes
We would
remaining.
like to give her a short course of antibiotics. Is that clear to you so far?
Okay, doctor.
Okay, and your worry about the HIV, well, at the moment, the risk of her getting HIV is quite low because it's been lying around in the ground, and um, w- well, the risk is quite low, Sarah, so I don't think she needs prophylaxis at the moment. And what we can do is we can just observe. I don't think we need to check on any infections at the moment. Any other questions?
So, doctor, is there anything that I need to tell Chloe's parents about Chloe's
Yeah,
care?
yeah. So I can tell that I will all include everything in my notes so that my health record also contains them. So she will be given the tetanus shot and the antibiotics, and if there's any sort of any uh, severe pain or any discharge, swelling or redness in the area or if she develops any fever, then you can also always contact us again to see whether there's any infection going on. Other than that, if she complains of any pain, you can give some paracetamol. Um, is that all right? Anything else you want to know?
Okay, doctor.
Okay, thank you.
Thank you.
Okay, I didn't have anything to say actually. Okay.
Move on to the next station.
Yes, this is a pretty interesting case, isn't it?
Yeah, I've not read about it at all, so I just thought whatever I wanted.
Yes, yes, not bad, not bad. This was actually a good attempt. And thank you so much, Dr. Mishi, for
Thank
the
you,
great.
Michelle.
Thank you. Most welcome.
So, yes, let's talk about the issues over here. So, what is the main concern of this nanny, that she's worried about her job, she's worried about her getting an infection, right? So, did you address both of them?
No, I forgot about the job part.
Absolutely. So you have to reassure her that it's not her fault, right? Like this can't happen, right? Reassure her, keep her, saying that you did the right thing, encourage her, right, of what she has done, isn't it? That you did the right thing by
Yeah.
washing. And I don't think that yeah, you did the right thing for this kind of a situation. So good job for that, right? And apart from that, what is the important thing that you need to ask? You ask, what did you talk to her parents? What did they say? The main thing is, are they coming? Have you informed them to come in? Right? Because the conversation that you need to have or you need to continue to have is not the conversation that should go to the parents is should not be coming from the nanny. It should be coming from you, isn't
Right.
it? Who
Yeah.
is the guardian? The nanny is not the guardian over here. You need to be talking to her parents. That's
Uh-huh.
your job. You need to relieve the nanny of her job, saying that good job for what you have done so far. Thank you so much. You've done the right thing. From here on, I'll handle it. Right? I will talk to the parents. I will reassure them that you did the right thing.
Yeah.
Isn't it? So you need to
Yeah.
understand, your role in this entire station. Like, what are you required to do? You're required to take the history from the nanny, ask her about, the information about the child as much as she can provide, and then you need to relieve her, saying that don't worry, we'll take care of it. Did you inform the parents? Are they coming in? Don't worry, we'll look for signs of infection since you're worried about that. And any concerns that she has about HIV and hepatitis B, definitely that's also something that you can address. So it's less likely because it was out of hospital, right? And also these bugs don't stay viable outside of in the open environment, so there is very less chances, right? So a couple of things that you did right was you asked about the needle. That's very good about the needle. Like you asked about the kind of needle that was there, and what was the it could be any kind of a needle. It could be like a sewing needle. It could be like a suture needle. Like there are so many different types of needles. What was the needle? Was it the main thing about these cases for any needle stick injury prophylaxis? You have to remember that the bloodborne infection rates are much higher when it is in hospital, and second of all, when it's a hollow bore needle. So, what do you guys understand by hollow bore needle? Anybody? Anybody? Any explanations on hollow bore needle? Do we have any volunteers? Come on, this is a very easy question. Like anybody hollow bore needle. So basically it's hollow, and basically you use it to take anything that can cause the blood to rush into it. Like for example, have any syringes, if you have any IV cannulation, those are all hollow, right? Those needles, so that the blood can pass through it rather than a solid needle. So in what solid needle would you see in a hospital setting? Can you guys, do you have any idea? Anybody? Any of the suture needles, right? Those are all solid needles. They don't have any hollow inside of them, right? So definitely those are the ones that are associated with higher risk. So keep that in mind. Understand what is the needle that
Yeah.
would prick. Yes.
So usually in such places, I mean, having a solid needle is very less likely to be there. It's like a park. Maybe that it might be dropped by some IV drug abuser or anyone like that, because it's very unlikely for a needle to be present in a park.
How much guarantee can you give me of that? It
Yeah,
could
I can't give any guarantee of that, but I mean, from a I don't know, it's
So this
quite
is,
unlikely.
you're absolutely
Yeah.
right. And usually there are a lot of instances where IV drug abusers go there, and so you would expect it to be a hollow bore needle. But then, those are things that you're making assumptions on. But what if it was a nanny knitting, or crocheting? I mean, definitely they could drop a needle or two. You don't really know what needle it is, right? And
But how much time, like, in such panic situations, like, I mean, it's not very easy to, look into a hollow or a solid needle. I mean, you need to look it very precisely.
so
Yeah,
you'd be
right.
asking them to describe the needle, right? So she mentioned that it was a needle with a syringe attached to it. So what does that mean? It is definitely hollow, right? If a syringe
Yeah,
needs to be attached,
yeah, yeah,
right? You
definitely.
will just ask her to, can you describe the needle? Like, could you explain?
But like a normal layman person would know this much about a needle.
No, so you are looking for hollow bore needles. Right? You won't be asking them for a hollow bore needle. You would be asking them to describe the needle to extrapolate whether or not it's hollow bore. Right? Could you please describe what was the needle, and what did you do with the needle after that? Do you have it with you? So she could have brought it also, right? Or she could have disposed it.
Okay.
So in the case, I think in the Canada information, it's mentioned that she's disposed of the needle. But those are all the important questions to ask, right? Could you please describe the needle? Because in your mind, you're thinking for any risk of infection, high, high, what is the incidence of bloodborne infection, you are thinking along the terms of, I'm looking for hollow bone needle, but I cannot ask that to the patient, right? So how will I be asking? I will ask her to describe it for me, and asking her whether you brought it in, what did you do with the needle? Can I take a look if you have it with you, right? So that would be your way of understanding what the needle is. If you get this information, that's very good. If you don't get this information, that's also all right, right? You're still trying to understand what type of a needle. But also in this case, you have to remember, like, what are the chances of the infection to be there? So you also asked, Dr. Ranmali very nicely also asked, was it stained? Was there any blood marks? So that's also an important question to ask, right? So one other thing, if it's in a hospital setting, you will be asking when was the last time it was used? What patient was it used? What procedure was it used for? And when was it last used? So to understand, was it immediately pricked? What were you doing when you got pricked, right? Immediately after, it being inserted on the patient, did you get pricked immediately after that, to understand the time? Over here, there is again a low risk because it's been there for God knows how long. Right, so you will definitely considering it as a low risk for sure. Right, so out of hospital is kind of a low risk, but then still you would want to know the incident history very well. Right, and witnesses, this is also very good and important to ask. So you want to see if the child is safeguarded. So one other important question to ask is this the first time this has happened under your care? Like, how often has this happened that she's got pricked with a needle? What if the nanny itself is, taking drugs and accidentally, left it around and got the child pricked? Definitely, one other question is, how often has this happened in your care? Right, that's also a good question to ask. Associated symptoms: bleeding, redness, swelling, fever. Since then, right? How did you manage it? Squeezed hand, washed it under running water. That is something that you are expecting to do. So that's good. That's a good question to ask. Otherwise, parental involvement. Did you inform the parents? Are they coming to the hospital? What did you talk to them? Are they coming in? Because your next job is to talk to the relative, the guardian, not the nanny, right? Even the history that the nanny gives, you can't take it as like evidence. If it's coming from parents, it's a different thing, right? You can't trust how much the nanny knows, right? You're just getting an initial history from them. So definitely, if you are suspecting, if you are thinking of immunization status and all, you will be asking her, and then you will be confirming it with the parents to see if they were actually vaccinated, right? Ask about vaccination history. Is it up to date? Any other symptoms? Past medical history? Because over here you're looking for any, immunocompromised state, right? Ask direct questions. Address direct questions asked by Sarah in a structured way after getting data. I understand you're worried about HIV prophylaxis and about possible infections. Let me gather some more information first, and I will explain clearly what risk there might be. So this nanny is actually really, is very anxious about her job and the risk of any, infections. So definitely you want to calm her down and tell her that let me just get some information, and then I'll be in a better position to actually explain this better, right? So so now you have to think about the person that you're talking to, put them a little bit at peace, right? And understand a little bit more about the child, who does she usually live with, are her parents contactable right now, right? And, also, has this happened before? All right. And then the management. Now, the management is very important because over here, the management, you will be actually doing the management in a way that you will be explaining to the, the nurse addressing her, the nanny addressing her issues, right? Her concerns at this point, right? So explain the risk of HIV transmission is extremely low, almost negligible from community discarded needles, as a virus does not survive long outside the body, does not need post-exposure prophylaxis. So good job on that, Dr. Ranmali. That's actually right. And the other things about hepatitis B, C, and tetanus, that's important. Why? Because the next dose, even though there is one more booster dose, as you mentioned, so there is immunity carried on till the next booster dose, so you don't really have to give anything. The whole idea of giving the booster is because there is still immunity for the last dose that she has had, right? So at this point she is actually protected, so that is fine. So when her next booster dose will come, then you would actually be giving her the next, because she is in the protected period. So do remember that you don't want to give them extra, right? And also by 16 weeks, the Hep B is also cleared. What you can do is you can actually check for the titers. Sometimes there might be a failure and you may actually want to check for titers, but in this case, the risk is very low, right? Since it's a community needle. So no need for post-exposure prophylaxis, right? And then what you're going to be doing is you will be informing the parents when they come, right? Discuss the necessary steps and reassure the nanny about the care provided, right? And you will be understanding a little bit more about the vaccination status from the parents mostly. And the main thing is document what has happened. That is very important because you're getting the history from the nanny. Document what the nanny has provided you, right? So that's like a third person, right? And then offer them follow-up leaflets and pamphlets. Say that we will be having an ongoing care for Chloe. I'm sorry, what's the patient's name? Yeah, Chloe. And also that, we'll be confirming the vaccination status with the GP in order to plan post-exposure prophylaxis if that is the case, if she hasn't gotten vaccinated, that is. Yeah. All right, so let's quickly look at the performance. 1 moment. Yes, Dr. Ramal, you have a question?
Can I please see the patient information card for 1 second?
Patient information? Is this the patient information?
No, the candidate information, sorry.
Candidate information, this one?
Yeah. Okay, so it said parents have given their consent for treatment following a phone discussion. I think that's why I didn't, yeah, but I still need to talk to them, isn't it? The doctor, does it mean that the doctor has spoken to the parents or?
Yeah. At this point, it's hard to, find that information. You might have not spoken to the parents directly at this point, since you don't have you have to explain the fact that any other further treatment and management plan will be discussed with the parents. There's no point in discussing with the nanny.
True. Yeah. Okay.
The nanny feels that she is responsible, so she also wants to talk to the parents. So she's like, it's okay, you're kind of relieved, so don't worry about that. I will talk to you if necessary.
Okay.
Right?
Thank you.
Right? For the management and answering any questions if they have any. Yeah. Yes. No problem. All right, so let's look at the marks. So data gathering, that was done very well. Where you identify the patient, full name, acknowledge the concerns, validate the emotions, signposted. I'd like to ask you a few questions to understand exactly what happened today. You asked the incident history, how the wound was managed initially, asked about Chloe's HIV status, vaccination status to guide HPV and tetanus prophylaxis. Ask about the past medical conditions, allergies, elicited ice. Good job. Asked if Sarah witnessed the incident to confirm the mechanism and exposure details. So that is something that Dr. Mishi actually offered. But you can ask additionally. All right. I think I'd give you a mark for that. But yeah. But definitely keep in mind to understand whether she witnessed it, right? Definitely you would want to know that. And was there any other witness? These are all safeguarding points to understand, can I corroborate this history with somebody else who witnessed it? Just to understand that the nanny itself is not pricking her with anything, right? Ask for the type of needle. It was an request description to evaluate the risk, right? Like syringe, insulin pen. So just ask them to describe, the needle as such. Ask if she has the needle with her to assess the possible testing or disposal safety. Ask about any immediate symptoms such as bleeding, redness, swelling, fever to assess local injury or systemic effects. Right? Ask about the parental contact. Are they coming? What did they say? You ask what did they say, but you have to understand, like, are they coming right away? Yeah. Ask if similar history happened before under Sarah's care to assess possible supervision or safeguarding concerns. That's important. All right. So explain. So this is where you found it a little difficult, but don't worry about that. Let's just quickly go through, how you could have done this better. Explain clearly that you have gathered the information and will now explain risk and management. Explain diagnosis in layman terms, since she has a minor needle prick injury, but the risk of any serious infection is extremely low. Reassure Sarah that serious infections like HIV from discarded community needles are extremely rare. Explain the HIV risk is negligible and HIV post-exposure prophylaxis is not indicated in this scenario. Check Chloe's vaccination history to Hep B protection status. Provide, I think I'll give you marks for this one, right? Provide leaflets on needle stick injury and tetanus prophylaxis. Advise Sarah to return if Chloe shows any signs of infection, because you know that this is the nanny. So if at all you feel that she is developing any infections, or if any local development of local infection or pus discharge or anything happens, you can always bring her back, right? Reassure her that it was not her fault and that she did the right thing by bringing Chloe in. So what you can do from your end, you will explain that you will be cleaning the wound thoroughly with soap and water again if not already done, to ensure proper wound care. Advise no antibiotics are needed unless signs of infection. Right? Explain no hepatitis immunoglobulin vaccination is needed if routine vaccinations are completed. Explain there is no prophylaxis available for Hep C, but the risk remains very low. Explain that you will speak to the parents once they arrive. Right? So at this point, this entire case is basically how you talk to somebody other than the parents, like a third carer. Right? So like, how much information can you get out of them, and how will you be putting them at peace with their concerns, right? So clear empathetic communication, low risk of contracting the infection, clarify the steps for tetanus prophylaxis and follow-up tests, offer psychological support, address Sarah's concerns and fears directly, maintain eye contact. Again, this is something that you can't really do, but definitely if you are having the consultation, make sure to be doing this. All right, these are points that you should keep in mind, right? Reassure her about her job and that the parents will understand the situation, right? That's the best you can do. So good job, Doctor. That was great.